Hi, everyone. My name is Matt. I'm working with Freddie to help organize this event. Just wanted to say thanks to everyone for coming. I think we could get started, and then anyone who wants to trickle in can. And if it's okay with you guys, we were asked by the CAOMS to record the meeting so we could post it afterwards, if that's okay with you.
Yeah, sure. Yeah.
Okay, great. So thanks again for coming, and I'll hand it over to Freddie to introduce everyone.
Hey, thanks, Matt. Thank you so much. So, good morning, everyone. Thank you so much for joining on this Saturday morning. So, the topic for today's CROMS annual webinar is like fellowship or not, experiences from our recent Canadian OMFS surgeons. So, our first speaker will be Dr. Gordon Wong, and I would just introduce him. So, Dr. Gordon Wong is an oral and maxillofacial surgeon based in Kelowna, BC. He is a partner at Kelowna Oral and Facial Surgery. His training included dental school at UBC and OMFS training at University of Arizona Phoenix, where his program took 24/7 facial trauma call, had high volume TMJ training, and robust implant training. His journey in oral and maxillofacial surgery has been both challenging and rewarding, from rigorous training to building a patient-centered practice. He's passionate about advancing the field by and chairing British Columbia College of Oral Health Professionals Sedation Committee, and through innovation by founding AI-driven solutions like Loom Health, a dental-focused AI scribe. Thank you so much, Dr. Gordon, for coming and speaking to us. Platform is all yours now.
Okay, well, yeah, thank you, Matthew and Freddie, for helping arrange this opportunity to speak with residents across the country, maybe even the United States. It's a real honor to be able to share my story with you guys. I just want to keep this pretty informal, so I'd like to make this more of a chat if possible, but I can start with just kind of talking about my journey and how practice has been since graduating. As Freddie's already said, I graduated from Phoenix in the United States. The reason I chose that program is because when I was in dental school, I did a couple externships. I went to McGill, I went to Fresno, Banner, and Shreveport, and I was just kind of exploring what it was going to be like to be an oral surgeon if that was something that I was very interested in. And one thing that really kind of stuck with me was the facial trauma aspect. I really thought that was a great service, a great skill to be able to offer my community. And I honestly thought the surgeries were just very interesting. It's interesting because we have Jeff here and he's in a microvascular training program. But I remember when I went to McGill, it was my first externship. It was February, it was cold, and they were doing a lot of microvascular surgery, and I was like, I remember watching some of these surgeries, like this is crazy. This is not even like dental world anymore. Like this is insane. I'll be honest with you guys, it kind of put me off a little bit because I was like, oh, maybe if this is what oral surgery is going to be like, it's I'm not sure if this is for me. But I talked to my wife. I got encouraged again to kind of like explore more about oral surgery, and I went to these other programs and saw a wide range of like, as you guys know, it's a pretty big scope of what we do. So then I kind of went to Banner because it was what I was interested in, TMJ and facial trauma. When I went to Banner, they developed a microvascular program within the first year of me being there. To my surprise, they didn't tell me during the interview process that they were going to do that. So it was something that came as quite a shock. And I remember doing the rounds, doing the flap checks and doing the surgeries with the attendings. And yeah, I actually liked it after a while. I just, I got that experience. I was like, holy, these like maybe I want to be one of these like, surgeons doing all these big crazy cases. And I thought about doing microvascular fellowship too, and I started exploring some of those avenues. But I think that for me, when I started thinking about what my life was going to be like after training and kind of reflecting, my interests kind of changed, and I've just kind of stumbled along and kind of found that, for me, I think private practice was good. Taking facial trauma, call it in my local hospital, is rewarding for me. And then, yeah, just still trying to develop my TMJ orthognathic practice now that this is actually my 4th year in practice now. So there's been a few things that have occurred. But yeah, it's been really rewarding. So yeah, life outside of residency, uh, it doesn't, I don't necessarily think that it gets any easier, right? Like you think residency is a lot of work, but I remember when one of my attendings said to me, he said, residency is not, it's not a rite of passage, like once you're done residency, like the doors open up and like everything just gets easier. It's more of a conditioning for what your future is going to be like. The work doesn't stop. The amount of effort that you put in is still up there. You just have different types of stress, I think, after you're done, right? Like for me as a private practice guy, and I just bought into the practice, this might be my 2nd year now. Some of the biggest stresses that I deal with today are kind of just like patient management still and staff management, right? Like how to run a practice. You don't learn that kind of stuff in residency. So that's going to be another big learning curve, steep learning curve that you guys will all kind of face. Yeah. I think, what parts of my practice have met my expectations. We're very lucky to be part of this specialty. You get to do cool stuff, and you get reimbursed pretty well for what you do. You get a certain level of lifestyle, but I still think that you still have to put in a lot of work, right? It's not a cakewalk after being done. Yeah, you still have to go out there. Some of the most challenging things you have to do now is just kind of like build up your referral base, kind of create your reputation in the community. Try to advance the specialty, give back. Like for myself, try and be part of the sedation committee. I'm still trying to make sure that, our specialty is being advanced. I'm speaking for us, trying to maintain our anesthesia privileges. Yeah. What aspects of my experience during residency was most important or helpful in my practice? Well, I mean, for facial trauma, like that's what I like to do. I got good experience there, so I think the experience I had there was worthwhile. It's carried forward. Like I'm not really too nervous about anything that comes in through the door now. Like I've seen a lot of it, and I can work my way through it. I also liked TMJ surgery. My program did a lot of like open joint procedures, joint replacements, probably did like 20 or 30 joint replacements before I was done residency. But one of the things that I was lacking in training was probably scope work. And I think, there are, continuing education courses that you can still do. There's like the Nexus CMF. There's also the mini residency in Arizona. I'm actually going to go there next week to try to improve my skills, right? Because you'd be wrong to think that once you're done training that you're at your best. You won't be. Like even the fellows here, right? They will know that, yeah, you're going to be experienced in what you do, but you're not going to really be that good at what you do until you get that experience, the number of reps that you do. Like it'll be years before you really hit your peak, right? Like even taking out wisdom teeth, like, or your residency, like, oh, wisdom teeth it's simple, whatever, like, but some of that stuff will humble you, right? Like I'm probably just getting like super quick and efficient at it now, and I'm in my 4th year of practice, right? So, yeah, I think fellowship was something that I did consider, but I think that after kind of deliberation and just kind of reflection on like what I think is important for myself, and I just kind of knew that you're just going to continue to learn, that you're going to get more experiences. Even your residency, you're not going to learn everything that you think that you should know. Like, I'll be honest with you. I mean, in my 1st year, I got a referral for a surgical uprating case. I'll be honest, I never did a surgical uprating of a second molar in residency, and just asking my partners, my colleagues, and then like reading a couple texts on how to do it and all this kind of stuff. Like it's not as daunting as you think. You got the baseline foundational skills. It's just sometimes you're just going to come across something that you've never done in residency, because that's kind of just the way it goes, honestly. Yeah. What are some considerations for choosing a place to live and work? Well, I always knew that I wanted to come home and be around family. I definitely wanted to have a hospital practice or component to my practice, not a hospital-based practice. But yeah, back in Kelowna, I had the opportunity and there was a spot that could be filled here. So I think that was just kind of luck. But I also think that if you work hard enough at anything and advocate for yourself, that eventually you'll get it. It is a little bit more challenging in Canada to get hospital privileges in certain cities just because of the amount of practitioners that are there. But yeah, if you're patient and you work hard enough, I think you'll be able to get it eventually. But yeah, that's kind of, I guess it's my monologue then.
Thank you so much, Gordon. Thanks a lot. That was a great monologue, though. Does anyone have any questions for Gordon? Well, I can begin with one question for you, Gordon. So when you finished your residency and you were about to go into the job market, like, did you had any pushback with regards asking, like, were they asking for you, like, have you done any fellowship, or did you face any challenges because you didn't take the fellowship route?
That's funny because the practice that I joined, my partner's Scott Martini. He's a cleft orthognathic fellowship guy. He went to Dalhousie. He asked me the question. He's like, "Oh, like, are you planning on doing any fellowships? Maybe you want to consider doing the TMJ fellowship that's over in Toronto. You can offer something different." And uh yeah, I kind of answered with like, yeah, I got pretty good experience in TMJ stuff, and I do want to offer that to the community. Um, but I also kind of told him like, hey, like these are kind of things that I'll continue to learn and get better at, improve at, and I think that suffice, right? Like I think it's going to be a little bit different if you're going to join a head and neck practice, right? Like if they're going to want that, right? Um, but yeah, I also want to keep it pretty general. I want to do core, oral, and maxillofacial surgery, right? Like I don't necessarily want to devote myself to just TMJ either. So, um, yeah, when they're interviewing you, you're also interviewing them, right? You got to know and tell them what you want to, right? So, yeah, it's about finding a fit. I did come across that question, but it didn't hinder me at the end of the day.
Thanks. Does someone have any questions for Gordon?
I just have a quick question, Gordon.
Yeah.
Thanks so much for the presentation. We appreciate you coming and giving some insight into kind of your journey from residency all the way to practicing. I guess the question would be, I assume you're taking a lot of facial trauma, and that's the primary reason why you went into, Phoenix's program. You had mentioned that. I'm just wondering, in terms of the facial trauma that you currently experience in the community, are there any points in time where you kind of wish that you did a fellowship to be more comfortable in complex facial trauma? Do you think there's any value in doing fellowships in trauma surgery?
Um, I think there's value if you feel that your program doesn't adequately get that experience, right? Like if you guys do facial trauma like 1 week out of the month, then the experiences that you may come across may not suffice. But I think to answer your question, like going to fellowship is if you're super interested or feel that you wish you had a little bit more experience in certain aspects of your training. Um, the example would be my co-resident actually went into a fellowship. He went into a TMJ trauma implant fellowship, and him and I have very similar experiences. But I think for some people, they want a certain level of they want to feel a certain level of comfort when they're done their training, that they've seen everything. As for me, I kind of took the mindset of like, I'm going to only continue to learn and experience these things and get better at it as I go. I never thought to myself that I was like at my absolute peak leaving residency. I just went with the mindset that I'm going to just experience these things. I have the foundational knowledge to treat these things, and I'm only going to get better at it with time. So
Okay.
that's how I'd answer that question.
Thank you. So over the first few years of practice, you feel like pretty much the setup that you have is something that will make you feel more comfortable over time, not necessarily doing the fellowship. Have you felt that like over the first few years of practice covering your facial trauma that you've become even more comfortable than you already were in residency?
Yeah, I mean, I've come to, yeah, I'm definitely getting better at it because the thing is like when you do these cases now, you're doing them by yourself, or you might even have like an assist. You're bringing one of your assistants, or if it's a really complex one and you have partners, you can bring them in. But you get better at doing these things by yourself and learning how to, get somebody to retract for you and look at certain things by yourself because you don't have your attendees, you don't have your co-residents anymore. It's a bigger challenge for sure leaving. I think that's the biggest thing that I've learned is how to operate by myself.
Yeah.
Yeah.
Thanks, Gordon.
Yeah, you're welcome.
Hey, Gordon, thank you for the talk. Really appreciate it. My name's Jacob. I'm a second year resident at McGill. I just wanted you to talk about maybe as a community surgeon without any resident help, giving some services to the hospital. How do you manage your schedule? What's like your normal schedule like? Like how much do you prioritize? How do you, when the hospital calls, how do you manage your books, like whatever, 7 to 5 or whatever in your clinic, and you have to all of a sudden drop everything, go to the hospital. Can you just explain how you manage these priorities?
Yeah, that's a very good question, right? Because that's one of the bigger stresses I had after leaving residency. Yeah, how do I manage my clinic schedule and then take call? It's you do have to put things off and prioritize things appropriately, right? Like my clinic is number one, and then when I take hospital call, I'll go after clinic to go see them, right? Like it's very, like, I haven't even experienced it where I've actually had to leave clinic to attend somebody in the hospital, right? Um, but yeah, like to do all my trauma surgeries, all my on-call surgeries, that stuff is all after clinic. That stuff is on the weekends. It can be stressful. Sometimes you're like, I don't want to do this at this kind of crazy hour, but I have to do it because this is the time that's available to me. Um, and with the Canadian healthcare system, it is more of a cost containment thing. So you get limited times on the weekends. So only one room is running, or one room is running you know, after 5 p.m. and you just put on this wait list, you get bumped, you get bumped, you get bumped, and to just kind of deal with that it is stressful. But yeah, I think the answer to your question is I end up doing it after clinic hours. Yeah.
And then maybe one more follow-up question is that if you're providing facial trauma call to a hospital, is it just your private practice, from my understanding, you're in a group practice of you and then one more surgeon. Is it just that private practice that's serving the hospital, or do you group as a community of oral surgeons or multidisciplinary to provide the service? Like, for example, are you taking one and two call if you're two surgeons, or what is it like as a community guy?
So in our community, there's six of us, and we serve a community of about 300,000 people. For us, there's two generations of surgeons, I would say. There's the older generation, and then there's the younger generation. The three younger surgeons, myself included, take 1 week a call every month, and then the three older surgeons rotate that last week. And then there are plastic surgeons who also take facial trauma call here. So it honestly, it all depends on who the emergency physicians like to use, and they'll give them a call.
All right, thanks a bunch.
You're welcome.
Are there any other questions for Gordon? Well, thank you so much, Gordon. We really appreciate all your inputs. It was really, really great. We'll move on to the next speaker now. Our next speaker is Dr. Jeff Chadwick. He's a second-year fellow in maxillofacial oncology and reconstructive surgery program at the University of Texas Health Science Center at Houston. Jeff received his Doctor of Dental Surgery from the University of Toronto and completed a general practice residency at the University of Western Ontario. Jeff is a Canadian and American board-certified oral and maxillofacial radiologist as well as oral and maxillofacial surgeon, having previously completed both programs at University of Toronto. Concomitantly with his MSc and PhD degrees, which focus on innate immune system response to local and systemic inflammation. Thank you so much, Jeff, for joining us. The platform is all yours.
Thanks, Fredo. I'm going to try and share my screen.
Yeah, we can see your screen, Jeff.
Sweet. Let's see if this condenses at all. It's been a while since I've had to do this, bringing me back to the residency days. There we go.
Perfect. Thanks so much.
Almost there. Perfect. Awesome. So just like to thank you, Freddie, and you, Matt, and Matthew for inviting me out and the entirety of the CRAOMS for the invitation to present. It's funny because I remember attending this session many years ago and myself obtained some few key pieces of information that helped me on my journeys. So I'm glad to be able to find myself on the opposite side of the fence and hopefully return the favor. So Matthew provided me with a litany of questions that we could answer. I know Gordon wrapped all of them off on his end, so I'll try to do the same on my end. The first is the journey, and luckily Freddie did an excellent job at recapitulating the academic adventure that led me here. And I guess the one thing that's obvious is I've been in training for the last 10, 11, 12 years now. Since starting my radiology residency. I have yet to burn out, but I'm glad that the journey is slowly coming to a close, and I've honestly enjoyed every bit of it. And I've only found myself working for a total of 2 years on the outside of a training institution and never been on the outside of a hospital or training program. So since I'm still in the midst of my fellowship, everyone's kind of got a different flavor today. I was going to try to provide you with kind of my day to day and my fellowship experience, and then just some of the things that I was thinking about as I was going through the process when I was a resident. So starting off with our training program here at UT Health Houston, we service 5 separate hospitals under 4 health systems. In general, we're operating most days, and then in the context of the staff, the program's structured and set up in a unique way, some of which are different between fellowships, especially in the head and neck realm, which is something that I'm going to speak more about just because that's my experience. So on our OMFS side, I have the pleasure of being, mentored by John Shum, who's the overarching program director, James Melville, who I'm certain many of you know from his reconstruction work, both with tissue engineering as well as nerve reconstruction, as well as one of our more recent additions, Jack Waugh, who also did their OMFS program, but then did his plastics residency and is now back doing flaps with us. And that's on the OMS side. And then there's an entire different side on the ENT, in the ENT realm, where we roll with the 4 gentlemen that you can see at the bottom there, the primary of which is Dr. Andrew Wong, who himself did the MD Anderson Head and Neck Cancer and Reconstructive Fellowship. And then on the ablative side, Eddie Liu, as well as Dr. Ray Wang, who did the WashU Head and Neck Microvascular Reconstructive Fellowship, and finally Eitan Weinstock, who also did the MD Anderson Head and Neck Fellowship. So these are the people that I spend the majority of my week with. The fellowship that I'm in is a 2-year fellowship. There's two of us, a junior and a senior fellow. As you can see, there's a bit of an expanded scope when we combine things with ENT, and this is not all of our staff that we rotate with, mainly because our junior fellow, while both on the OMFS side, also has the UT Health Houston ENT physicians and surgeons that he attends with on a weekly basis. There are multiple research responsibilities, radiation oncology, as well as medical oncology rotations that comprise a core part of our program, which we're also required for accreditation. Resident teaching, also a core component. We all have a resident swap queue monthly that are with us specifically on the OMFS side. And in that regard, the residents are, reasonably well integrated into the head and neck program in the OMFS program. But we do rotate with them and round with them on a daily basis, either myself or my co-fellow. Whereas on the ENT side, grossly resident run, really only rounding if at the behest of one of our staff think that we need to go in to see something. So the resident team on the ENT side takes care of a lot of the day-to-day work. Just to give you an idea of what an average week might look like in our fellowship, this was just last week alone, and you can see that it was 5 out of 5 days in the operating room with a pretty wide spectrum of procedures, which a lot of that is thanks to our owing to our ENT colleagues. So, Monday, fairly, generic procedure starting on the front end with OMFS for mandibular resection, for Amarange with just a plate reconstruction, and we reconstructed the nerve, but then switching gears entirely to wide local excision for a sporanocarcinoma, right parotidectomy, neck dissection, and then, employing some of the reconstructive skills and just local reconstruction with a cervical facial advancement. Tuesday, in conjunction with our neurotology colleagues for right temporal bone excision and facial nerve decompression, and then on our end, a parotidectomy, neck dissection, and then an adipofascial ALT reconstruction. Wednesday is a bit of an oddity as well. While you could consider the first case a fairly bread and butter ENT or OMFS-based procedure, the procedure on the back end is again another application of the things that we learn as reconstructive fellows, using our microvascular techniques to supercharge jejunal pull-ups for esophageal anastomoses in the setting, in this case, of an esophageal discontinuity secondary to some complications following and esophageal cancer management. And then Thursday, much the same as Friday with our usual procedures. Although we, as a bit of an outlier, we do sometimes provide anterior neck access for our neurosurgery colleagues who are doing ACDFs, as well as some of our vascular colleagues for carotid exposures. So it's a fairly wide and broad mix of cases that are not limited to oral cavity proper, which, as I'll get to, it may be a consideration for when someone's perhaps choosing a head and neck fellowship. This is all, of course, in addition to rounding daily, which includes the weekends, which is where I just was. Normally we have clinic 1 day a week. For me, it's usually on Wednesdays with our otolaryngology colleagues, and our OMFS staff have clinic Mondays and Wednesdays just for a half day each. To supplement the time, there is no assigned call, but you're really on call 365 days a year. If there is a head and neck patient in house, either myself or my colleague is on call, and there's never a time that there's no one in house. So you're always available, or at least making arrangements to have someone available. We do occasionally cover trauma on the OMFS side of things, which has been actually an excellent experience and definitely has broadened my scope in terms of trauma management at what is touted to be the busiest level 1 trauma center in the United States at Memorial Hermann. So they're just things that we, otherwise don't really see in spades in Canada. And then in terms of just fellowship considerations, there are many. And, why did I choose to do my fellowship immediately after residency? And these are just things that, you can think about and reference, especially for any of the junior residents that are on the call. But, while the list of questions for Matt regarding practice don't really apply here, the ones for fellowship certainly do. So one of the first things you need to ask are which patient populations or specific conditions that you actually enjoy treating or find interesting. And then, the second thing is you need to ask yourself is, do you need a fellowship to actually accomplish this? Because, this is a significant investment in time, which does come with an opportunity cost, which I'll get to a bit later. Another thing you might ask yourself is whether or not you were considering an academic career. Say, in my case specifically, components of or people doing head and neck. This is not necessarily a fellowship that translates well to private practice or practice outside of a major training institution. So, when you're looking at fellowships, there is a really fine balance between passion and practicality. The next thing is what could I do with my fellowship training, especially coming from the Canadian side of things, which is a unique thing, especially in while training in the United States. And you need to be comfortable with what you cannot do when you're going to certain regions, whether that's from state to state, institution to institution, or from country to country. The next thing was, looking at what were core components of my training at the University of Toronto and what skills that I thought I needed further development or that I wanted further development in, and then considering, how well those would translate to other areas of practice. Having a reasonable research background, I was always drawn to that, but you need to ask yourself, how much research you want to do, how much clinical practice do you want to do? Are you polarized on one end or the other, or is there a combination that, sits well with you? Keeping in mind that much heterogeneity exists between fellowship programs within the same subspecialty regarding those elements. The next thing is starting right after residency. Did I want to delay this decision because of the uncertainty in the choice of fellowship, or another opportunity that I wanted to explore first? Was I burned out after 10 years of training? These were questions that I had to ask myself. Clearly, the answer was no. But there are multiple people that I've come across, even in the program I'm in now, that joined fellowship after a few years out in practice. The next thing, and I think Gordon briefly touched on this, was I willing to give up other elements of our already broad scope to focus on that subspecialty, as my training would otherwise be focused on a core number of procedures. Another big question is, did this make sense financially? Fellowships can either be, 1 or 2 years long, and it all goes back to that opportunity cost that I mentioned early. Whether that's practice opportunities that have come and gone at the time you were finished residency, the remuneration that you otherwise would have encountered while you were in practice. These are things that need to be taken in consideration, especially if some of us are carrying debt coming out of residency. On the other side, I've not really had a taste of post-grad life, so it was pretty easy to remain entrenched in training. It's really and then the next thing, and Ryan and I were discussing earlier, and goes back to the opportunity cost and location, is anyone coming with you? So family needs to be consideration, especially if going stateside. Is that part of the family coming down to just live and accompany you? Are they coming down to work? Can they work? All logistics, things that need to be worked out well ahead of time. Which go to location of your fellowship, which might matter for 2 reasons. The first is just where you'd like to live. Are you tired of living in the north with the winter season and looking for a change? It's, as I said to the guys earlier, it's 30 degrees down here today and sunny out, and it's been like that the majority of the winter, although not that hot, but very seasonable. Or do you want to stay close to Canada and your family and the things that are familiar? These heavily influence where rural or urban environment, or a nice balance between the two. Again, that might be another consideration. Cost of living also varies widely across the United States. Houston is relatively similar to Toronto, if that gives you any indication of what things are like. Next thing, if you have kids, schooling in the region may be a consideration. The quality of public schools varies widely. Private education is very expensive and usually comes with some pretty significant wait lists. So again, this might influence as to whether or not family can accompany. And then the second reason for considering location is actually the program itself. It's was the major guide for my selection and ensuring that after I completed the program, I'd be satisfied with my training and that I could tell myself that I would be comfortable providing the care that I signed up to learn and then subsequently deliver. So for me, the high volumes of cases as well as the integration with our otolaryngology colleagues was a must for my selection. So exploring the answers to many of these questions took a considerable amount of research and time and conversation with family and mentors. So if you're a junior and you're thinking about this, I'd recommend you give yourself ample time to make this choice. Now, in terms of the process itself, in terms of application, the first thing is cultivating interest. And that generally happens pretty early in your training and then a non-CAD intern and junior years. For me, or my recommendation is spend as much time in-house as you can when you're training. I like to say that surgery is a participatory sport, and you need to be present to gain insight and experience and find out about the things that excite you and the things that you enjoy doing, the things that you don't enjoy doing so much, and have that help shape the decisions you make later. The next thing, and I can't stress this enough, is you need to talk to your mentors and your attendings about their experiences. This was crucial for my exploration and may end up saving you a ton of time during your search, as well as money during the interview season. These are the people that put you into contact with others who may be able to better speak about their experiences, fellows from those programs, if they're currently associated with as an academic staff in those programs. They can also give you some fairly excellent and candid ideas of what you are actually signing up for when you join up to one of these programs. Further, these would also be the individuals who are helping you out with research, which bolster your applications, cultivate your interest in the field, and hopefully result in publications and invitations to present at national meetings, which is also consequently where you end up meeting a lot of the people that are running these fellowship programs that you do need to speak to. It helps when people remember a face or remember the name and remember the work that's being done. The next thing is researching the fellowship programs, looking at the program reputation, the faculty involved, and the training quality. See where those people did their training and what research they do. Check for case volumes and case diversity. Ideally, I wanted as broad an exposure as was physically possible. So for me, it was important to not have my experience limited to specifically oral cavity. Evaluate your research opportunities, and then speaking of mentors, ensure that they play a crucial role in fellowship training. These are the individuals who are both going to guide you professionally and at one point personally. So I encourage you to look into the faculty backgrounds, both their research, their publications, where they did their fellowship, the years they've been involved in fellowship application or education, as well as subspecialty interests. In the context of research, and specifically for those interested in academic careers, selecting a fellowship encourages research then is almost mandatory. So you really do need to review what's happening within each of those fellowships and whether or not they're actively involved in ongoing studies, figuring out whether or not you will be the one leading projects on your own or with residents or for the residents. Determining whether your interest is clinical, translational, or benchtop, and then figuring out whether or not the facilities for any of those things exist at the institution that you're interested in. Also important is research funding. Is it available? Is it required? And these are more important questions now, given some of the reorganization in national funding bodies, specifically here in the United States. And it might seem obvious, but also ask about programmatic setup, inquiring about working hours, flexibility, because there are always things like conferences, courses, and for a lot of us, board exams, specifically on the American side. You should really have a very clear understanding of how the residents and fellows are supported in the working relationship between those two groups and whether or not you'll be providing, resident education at one point or the other. And then the final thing is talking to current or past fellows. You really get the most realistic view of the program. And again, the responses are usually fairly candid. And in the same vein, inquiring about post-fellowship career prospects and taking a look at all of the graduates that have gone on and where are they now and what are they doing, and if they're not in an academic program, why is that the case? These are key things in determining what program might be for you. Now, in the context of interviewing, this for me happened when I was a sub chief, so PGY3 at Toronto. These interviews are generally multiple days. They were incredibly informal. It was just a lot of conversations, some of which would last half an hour, some of which lasted an hour and a half, but all fairly low stress. But you do need to be prepared. The big things for me were keeping a fairly consistent narrative. So my CV, my statement of interest supported my aspirations, specifically with my research, my presentations, the rotations that I had done, previously clinical experience. In terms of getting support letters, ensure they're coming from someone who knows you well and can speak to specific qualities about, your character and your technical abilities, and hopefully they can supply that with examples that are relatively recent and can really demonstrate why you would make an ideal candidate in the program. Be engaged during the interview, even if it's informal, which can be challenging. So be prepared to speak about the subspecialty, your previous experiences, and how you specifically are going to contribute. Everyone's interested in what you think the future holds. Publications, definitely not underrated. I think it speaks towards your ambitious interest and curiosity. And then do your homework. Know the people you're meeting as well as their research interests. People tend to talk about the things they know the most. In terms of logistics, just in brief, visa is always an issue coming down to the US. I'm currently on a TN, but there are also J1s that are required. Some places require a green card. Training, some places don't mind the single degree. Some places require an MD. So be careful with your USMLE requirements as well as time spent on general surgery. And then state licensure is variable between programs. So noting specifically whether it's you need to go down in your medical, dental, or whether or not an academic license is possible. And then the final thing is personal development and just life in general. I was lucky enough to have my wife deliver our first child down here, but as I said, family comes at a cost, and my wife works in Canada, and they have not been able to spend an incredible amount of time down here, and fellowship is a very busy time. For instance, my wife delivered at 8 in the morning, and we got into the hospital at roughly midnight the night before, where I spent the first 5 hours while labor was being induced. I went to round, made it back just in time for my the delivery of my daughter, took that picture, and then went right back to the operating room, and then came back at night, where apparently I was the most tired one, as that picture of me sleeping was taken by my wife. So, and she gave me permission to use this photo, by the way. I had asked yesterday before I put this in. So, there are many things that I've missed to explore this opportunity. So you keep those in mind when you're making those decisions. On the upside, lots of opportunity on the fellowship end of things. It's been interesting learning how to put down the tools and actually teach the residents. I still want to operate all the time, so it is an interesting transition, but also very exciting to see interest evolve in people who are now doing the things that I found interesting and are finding interesting themselves. So just another benefit. Anyway. Glad to take questions, and this is actually the snow that we had in January. So very rare to see 3 inches of snow on the ground. This is where I live.
Thank you so much, Jeff. That was a great talk. Excellent journey. I'll just open up the floor for the questions for Jeff.
I've got a quick question. Thanks for that excellent talk. I think you briefly mentioned the process of getting a visa for
for going to the US. Could you just touch on that a bit more and how that works, how far in advance you had to apply, what that was like?
Yeah, so the TN, I could really only speak towards the TN specifically, mainly because I'm not eligible for a G1 or a J1 because I'm not dual degree and I didn't have to go the ECFMG route. So with the TN, it's variable from border to border, and again, I can only speak in the confines of Ontario, where I was able to get it. So every border crossing is a little bit different to get the TN. What you require to get your TN is the letter of employment, which generally comes from the Office of International Affairs. And there are very strict set of criteria for what constitutes the letter that needs to be seen by the border agents. The Office of International Affairs of these programs is generally very good at writing these to ensure that there are no problems. And then, depending on the border, some in Ontario you can just drive up to at any time before your employment starts, and you can get you do a very brief on the fly interview at that time, and you can get the TN visa the same day and get your I-94 form to be able to get in and out of the country. Other border crossings in Ontario require that you set up an appointment, and that appointment can be no more than 4 weeks before your interview. And specifically for the TN, they can choose to turn you away, and you have to just come back another day to get the TN visa. So it can be a bit of a stress-inducing event or anxiety-inducing event to ensure that you get the TN visa, because other things need to fall immediately into order after that, which includes getting your social security card, because without that, you do not exist in the United States. So without that card, you have no credit. You can't apply for a bank account or a credit card or a rental application. So there are many things that need to fall in line in a very certain order. The first of which, at least on the TN side, was obtaining the TN. Luckily, I didn't have any trouble. And on that same day, I was able to get the TN at our Detroit border, drive back in, wait a couple of hours for the things to be processed, and then I was able to re-enter the United States and immediately apply for my social security number, which took roughly 4 weeks to get. So I had everything in order for the beginning of the fellowship.
Okay. Wow. Yeah, that's a great answer. Thank you.
Cheers.
Are there any other questions for Jeff? Well, thank you so much, Jeff. That was great insights into the fellowship program in States and an excellent journey. We'll move on to our next speaker. Our next speaker is Dr. Ryan McCoy. He's a registered specialist in oral and maxillofacial surgery practicing in Edmonton, Alberta. He's a fellow of the Royal College of Dentists of Canada. A born and raised Edmontonian, Dr. McCoy completed his undergraduate Bachelor of Science and Doctor of Dental Surgery degrees at University of Alberta. He graduated at the top of his class and was awarded the Alberta's Premier Silver Medal and the Alberta Dental Association and College Gold Medal for academic excellence. Dr. McCoy went on to complete 1-year general practice residency at the University of Alberta Hospital. Following his hospital internship, Dr. McCoy completed residency training and master's degree in oral and maxillofacial surgery at University of Manitoba. Upon graduation as an oral and maxillofacial surgeon, Dr. McCoy went on to complete an accredited fellowship in orthognathic and temporomandibular joint reconstructive surgery at University of Toronto. Dr. McCoy practices full-scope oral and maxillofacial surgery and is also a clinical lecturer at Faculty of Medicine and Dentistry at the University of Alberta. Thank you so much, Dr. McCoy, for joining us. The platform is all yours now.
Perfect. Well, thank you, Freddie and Matthew, for inviting me to speak today, and thanks to Jeff and Gordon. Those were great presentations, and I think Jeff covered probably 90% of what I was going to say, so makes my job a little bit easier. I'm going to share my screen here. If I can, give me 1 second to try and figure this out. Alrighty. Okay.
Your screen, yeah, Ryan.
You can see that there, guys?
Yeah.
Okay, let me just, now I'm putting in slides. Sorry, guys, give me a second here. sort this out. Okay. Well, welcome everybody. Thanks so much again for asking me to do this talk on fellowship or not. I'll kind of go over my experiences in terms of, my residency, my fellowship, and then just kind of some considerations for everybody that's thinking about potentially doing fellowships or moving forward just straight into practice. Oh, it's not letting me go ahead. Okay, so my story just really quickly, Freddie kind of outlined it for the most part. I did a BSc and my DDS degrees through the University of Alberta, born and raised in Edmonton. I continued there with a general practice residency, went off to Manitoba after that and did a 4-year OMFS degree there. And then I went on to the University of Toronto and did my kind of TMJ and orthognathic fellowship with Dr. Suka and Dr. Caminiti and the Toronto team. And now I'm working at Renew Oral and Facial Surgical Center. That's an oral surgery practice in Edmonton, Alberta. I wanted to just pay tribute, obviously, to some of my time in Toronto and obviously my time in Manitoba. Just a few little photos from my experiences there. In the bottom here, this was, I think, in my first year residency. There's Rob Marks came and gave us a talk, and some of, all of these residents are now graduated practicing surgeons and some of the obviously surgeons I worked with in Toronto that a lot of you know. Yeah, so we'll jump right into it. In terms of kind of fellowship or not, Matthew sent out an email to us and gave me a bunch of questions to answer. So I tried to answer them as best as I could in kind of a PowerPoint format, so everyone can just take a look and take some screenshots or take some notes if you wish. So first and foremost, fellowship or not, like what are the main considerations? I personally think that the biggest consideration is probably what do you want your practice to look like? And Jeff did a good job outlining this already, but do you want to be in a private practice setting? Do you want to be in an academic setting? Do you want some sort of hybrid practice? Have you done a lot of research? Maybe that's going to be a big component of your practice moving forward. And then, of course, major surgery, all the stuff that, Jeff is doing, for example, down in the States. Not something that I'm going to be doing in my practice, not something that I want to be doing in my practice. But is that kind of what you're looking for? What's your comfort level with these types of surgeries, at the end of your residency? And then, what's your practice going to look like? Are you going to be an associate? Is there some sort of partnership opportunity? Are you wanting to own a practice? Are you wanting just to kind of have an academic practice? What's that going to look like? And then I think a really important thing also is who are you going to be practicing with, right? Like what does their practice look like already and what's their skill set? I think it's really important, and maybe one of the things that hasn't been commented on yet is, if you're going to join a practice and you're taking over a practice that's a super, super heavy TMJ practice, for example, and that person, has been practicing, TMJ surgery for 30 years, and you want to be a TMJ surgeon, maybe you don't need to do a fellowship. Maybe you can kind of learn on the fly with that person in the practice. That's just one example, but knowing, who are your partners going to be, who's going to be in your practice, who's going to be in the city that you're living in, are there opportunities for learning in that sense? The second kind of big thing is where do you want your practice? Or where do you want to practice? Knowing the surgical landscape and the practice environment or the culture in the city that you're going to be moving into is very important. I can tell you everywhere is very, very different. It's not the same, in every city. It's not the same in every province. Some cities, there's a big area of need in that city. Other cities might have 3, 4, 5 practitioners all doing the same type of surgery. You kind of have to take all that into account, right? As kind of Gordon had mentioned in his talk, OR time availability is obviously a big concern, especially in Canada. Is there time for elective surgery? Is there time for on-call surgery? Is it a one in, one out type of system? A lot of cities and provinces are like that. Some are not, right? But some cities are, one surgeon's coming in, one surgeon's leaving. There's like X amount of spots for kind of a surgical division. Maybe they are looking for someone, maybe they're not. And then what are your areas of surgical interest, right? Like, is there a need for, for example, an orthognathic surgeon or a TMJ surgeon or a cleft surgeon or a cancer surgeon on, in that hospital that you're wanting to go work in. Um, Consider your current program. That's a big thing for all the residents, right? Like, what are the strengths and weaknesses of the program that you're going through? Have you gone through a program, like Gordon had said, like that's a, very trauma heavy program. In Manitoba, it was very, very trauma heavy. I got good experience there with trauma management. If you're not going to a program with significant trauma management, is that maybe something that you want to do a fellowship in? How would your fellowship kind of complement your experiences that you've had so far? One of the things that Jeff commented on really well and is really important, at least it was to me, is personal circumstance, right? Like your family. For myself, I'm married. I don't have any kids right now, but as Jeff had said, is your wife or your partner or your husband, are they going to be able to come with you? Are you thinking about moving to another country where they can or can't work? What's your personal financial situation? That obviously, there's opportunity costs as well as kind of fixed costs that go along with, moving yourself either across the country or to another country. At least for me, it was something that maybe I didn't consider as much. But it is really expensive. Like I was surprised at how much money it took to move myself across the country and get new licenses and all this kind of stuff. So not something that you should forget about. And then life experience and travel. Like maybe, obviously you want to go to a fellowship and we'll talk about all the things when considering fellowship, but maybe it has always been kind of a goal or something you've looked forward to, is like living in another country, moving to another place, new experiences, things like that, right? Fellowships obviously can open doors to new opportunities, right? Like by doing a fellowship, you might get involved with journal editing, you might get, speaking invitations to conferences and universities and things like that. Gives you kind of a network of professionals for, your own personal counsel, and then obviously that you can collaborate with. And then, another thing that Jeff had already commented on is kind of the higher education standpoint. Like, are you going to be joining an OMFS residency program? For myself personally in Edmonton, there's no OMFS program. So I'm not actively teaching OMFS residents, but we do have plastic surgery residents that rotate through with us, with all of the staff people here. If you are going back to an education program, are you going to be offering new procedures and techniques with this experience that you got from fellowship? Are there gaps in the current training model in the area that you're moving to? So all of these should be kind of considerations when you're considering if you are going to do a fellowship or not. But just a little bit about how to assess fellowship programs. First and foremost, the easiest thing, check out their website, check out their program description. That's the kind of the first thing. First things first, read the ads in AOMS, CAOMS, talk to your colleagues, talk to people that have done fellowships before, kind of at least get an idea of like what is out there. And then, you can start speaking to kind of fellowship directors and different fellowship, or surgeons that are teaching that fellowship, outline your interest in the fellowship, gather information about the fellowship. Is that fellowship actually what you thought it was? Is it true to kind of what the program description is? I think the biggest thing, obviously, and Jeff commented on this already, is speak with past fellows, right? I think most of the time they're going to give you an honest assessment of what the fellowship was like. What's the operative experience? What's the exposure? What's the scope? Pre and post operative planning and management, I think, is really important. At least in residency, some of our residency experiences are, yeah, cut. You get to cut the cases, but pre-operative planning, post-operative management might be something that's lacking. And is that something that's also lacking in a fellowship opportunity? You have to kind of figure that out. How much autonomy do you have in a fellowship, right? Are these your cases? Are they your staff cases? How much on-call experience is there? Are you going to be an on-call staff? Are you going to be just kind of a fellow working under a staff? That's all kind of, important stuff to learn. And then, how much are these previous fellows using their skills? I think Jeff had commented on that, but kind of looking back and saying, okay, program has had kind of 5, 6, 7 fellows in the past. What are these people doing now? Are they part of an academic center? Are they using the skills that they learned in the fellowship? Maybe they're not. Where are they practicing? All that kind of stuff. And then I think the last thing is just the program culture. Is that something that you're going to gel with? Is that something that you want to subject yourself to 1 or 2 years? You have to make that decision for yourself. And then asking, obviously, your program staff at your residency program about particular fellowships. Maybe some of your program staff are fellowship trained, so they have kind of a good indication of fellowships that they've done, for example. A few other things. Begin thinking about fellowship, versus not doing a fellowship early. And Jeff had commented, nicely on that. First things first, you've got to kind of gain that interest in what the subspecialty is that you're potentially applying for. And then from there, kind of going through this list of questions and seeing, okay, is this something that's going to work for me, for my family, for my partner, for my kids, etc. And then, applying. There's no right answer here. And, one of the things that people potentially forget, and Jeff had commented on this as well, is that, you can apply right out of residency. You could potentially go and work at a practice or work for a couple of years and then go back into subspecialty fellowship training. There's no right answer there. Planning ahead and visiting the fellowship obviously is very important. And then, as Jeff had aptly commented on already, he went through this in more detail. Just, the match processes, like licensing. Are you going to go to the US? Are you going to go abroad? Are you going to stay in Canada? Visas, permits, all that kind of stuff is really, really important. And then obviously the current political climate in the country of interest, right? Like that's a large consideration for US fellowships. I have been in practice now for about 6 or 7 months, so I'm kind of on the other side of training. So I'll talk a little bit about building your practice. Obviously, I don't have as much experience in this as Gordon does. But, building your practice, this will vary greatly for everyone, right? There's no magic recipe. Are you starting a practice from scratch? Is it something where you're building a practice, you're taking out, a bunch of loans to actually build a space out? Are you buying an existing practice? Are you associating it in existing practice? Are you going to a city that you already have connections in, or are you moving to a brand new place and literally you don't know anyone in the city? It's kind of, that's going to be different for everyone. But I think the biggest thing with building your practice is, hit the pavement running, get your name out there, join study clubs. New practices are built on emergency patients and availability. Like when you go to a new city, you're going to be the most available surgeon on day one, right? You're going to have large gaps in your schedule. So, fill those schedules with emergency patients, get your name out there, start talking to, referrals and things like that about your availability. Obviously, considering the culture, right, that you want to create within your office and your practice is also a big thing. When you go into a practice, either as an associate or a partner or an owner, you know, everything kind of trickles from the top down. So you as the surgeon, you're going to create that culture, right? So, you might be joining an office. And one of the things that I've talked about with my partners is that it's a marriage, really, truthfully. You're going to work with these people day in, day out. So, is the culture of that office that you're joining really where you want to be? Can you see yourself working at that place for a long period of time? Or maybe you're not, right? Maybe it's just, hey, I'm going to associate here for a little while. I might plan on doing a fellowship later. I may plan on moving to a different city. So these are all just considerations to think about. Other things outside of obviously the nuts and bolts oral surgery, like, taking some accounting or management courses. Obviously, most of us, I would say, are not, super adept at owning a business or starting a practice. So, there's all these new considerations that you don't learn in residency and you don't really talk about in residency and fellowship. So, these are going to be kind of gaps in your knowledge base that you're going to have to fill. And then the biggest thing is just be patient. Building a practice is hard. There will be ups and downs, and kind of building your name, building trust and relationships within your dental community, that takes time. So, don't get discouraged. And I think the biggest takeaway points, at least for me, is there's no right answer, right? Everybody's experience is different. So whether you want to do a fellowship or not, there's a ton of considerations that go into that decision, and everybody's experience is different. Whether you do or don't do a fellowship, I think the biggest thing is just kind of go through your list of pros and cons and kind of work backwards, like figure out, okay, this is where I want to practice. This is what I want my practice to look like. Do I need to do a fellowship to supplement my learning? Or maybe, I'm going into a practice and joining that practice, I'm going to learn so much. It's almost like doing like a fellowship on the fly, right? One of the things, at least in my experience, is that, I've learned an absolute ton in the last 6 and 7 months just being in practice with, a new set of surgeons, right? So, the learning, as Gordon aptly pointed out, the learning does not end at the end of your training, right? You can get good kind of foundational operative skills and things like that in residency and or fellowship, but you're going to learn a ton once you get out. So, and lastly, we are very, very lucky to be part of the profession that we're in, right? There's ample opportunities, to build your practice and create kind of what you want in a practice. So just remember that whether you do resident or whether you do fellowship or not, we're lucky to be where we are, and you're joining a great profession. And I know everybody in the audience is going to be really happy once their training's done. And that's pretty much it.
Thank you so much, Ryan. That was a great talk.
Yeah, thank you very much. I'll stop sharing my screen here and I'll open it up for questions.
Hey Ryan, great to see you. We miss you.
Hey there.
Hey. You touched on it a lot, but maybe just one other thing that you could speak on, something that we've talked about in the past is like the funding available for different procedures, like especially for you doing a TMJ fellowship. Like you went back to a city where there was already well-established funding and
Yeah.
great mentors and support. So when did you have those talks with those surgeons about if they would want another guy doing those same procedures, if they would help kind of guide you through that? Obviously, that's a big decision. If you're going to pick a fellowship based off where you want to live or versus vice versa, you need to have those discussions.
Yeah, good question. So I think that's kind of a two-part question. So number one, Derek, is, number one, you got to figure out like what your practice is that you want, right? So if you want to be, for example, a cleft surgeon, let's just use that as an example. is there an opportunity where you want to go to be a cleft surgeon? I think that's really important. Like, do they have an oral surgeon on their cleft team already? Are they looking for another oral surgeon on their cleft team? Uh, in the past, has there been, people that have come in and tried to become a cleft surgeon in that city and they've, been successful or not? A lot of it's very different in every province, and in every uh, hospital even it's different. So some hospitals are, it's like a one in one out, like we have X amount of oral surgeons, we don't have any more OR time. This is the protocol for bringing a new surgeon onto staff at the hospital, and we are looking for a surgeon or we aren't looking for a surgeon. So that's really important, and just trying to figure out kind of if that's going to be an opportunity that is going to work for you, right? Like, for example, there are some places in the country where, if you're going to get training in like TMJ replacement, the hospital might say, yeah, that's not a covered service at our hospital, or that's not a covered service in our province. So figuring out if that's something, that's going to work for you. And hey, there's nothing saying it can't be done, right? That's the other important thing, is like, hey, maybe that's something that you're going to say, like, I'm going to spearhead this at my hospital and with my governing body in the province that I'm in. But, knowing kind of what you're getting yourself into is really important. So does that answer your question, Derek?
Totally, man. Yeah, thanks. It's good to see you.
Good to see you too.
Hey, Dr. McCoy. Thanks a lot for your talk. It was really insightful. Just wondering if you wouldn't mind just talking a little bit about your experience in the Toronto Fellowship.
Yeah. Yeah. So I loved my experience in Toronto. It was great. I had I feel like good kind of core TMJ training in Manitoba. We did lots of open joint procedures. Not as much as I would have liked, obviously. TMJ replacement was something that I kind of felt like I was lacking skills in. So my time in Toronto doing all that was fantastic. Um, at, l- I guess I'll answer your question in this way. Like currently in my practice in Edmonton, I'm doing, open joint arthroplasties, I'm doing TMJ replacements, I'm doing scopes. I'm using all the skills that I learned in my fellowship in my current practice. Now, obviously, I'm new to practice, so I'm building that. So it's not nearly at the volume that I was doing in my fellowship, and obviously it won't be for some time, I'm sure. But at the very least, I feel comfortable doing those procedures, as a staff surgeon in my community. So
Awesome. Thank you so much.
you're welcome.
Are there any other questions? Well, thank you so much, Gordon, Jeff, and Ryan from CRAOMS. That was a great talk from all three of you. There were lots of learning points, tips, and tricks over there. I hope if you guys don't mind if the residents send you out some questions, if they have any further follow-up questions, if they want to know more about how to go about the residentship, that would be great. I'll just hand it over to Matt.
Yeah, no, I mean, that's pretty much it. Just wanted to say thank you to the three speakers and to all of our fellow residents who showed up. That was really informative. That's about it.
Perfect. Thanks a lot, everyone, for joining, and that's a wrap for the day. Have a great weekend. Bye-bye.
Awesome.
Take care,
Thanks,
guys.
everyone.